Hello and welcome back to GB Video Podcast by Nadia. So, in the earlier podcast today, we spoke about the differences between two mental health conditions, which are ADHD and bipolar disorder. In this one, we will be talking about the similarities. I just would like to remind you guys that ADHD and bipolar disorder are both mental health conditions with distinct features and with distinct definitions that we have already discussed in our earlier podcast and in my previous podcasts that I have done before. But these two can often coexist. So, as a clinician, especially because these conditions are diagnosed by a psychiatrist, they should be really well aware of the fact, and they definitely are, that both these conditions can coexist. So it's very, very important to be very, very vigilant while diagnosing these conditions, either one or the other, or both of them at the same time. And because, as I've already spoken about this condition called Dr. Google, in which people go on Google to find their symptoms, on TikTok to find their symptoms, and on different social media platforms, because there is a lot of health literature and a lot of health knowledge everywhere on social media. So when you Google your symptoms, just be aware that it's not necessary that you would have only ADHD or only bipolar. You can have both the conditions coexisting at the same time. So when we have already spoken about, sorry for my bad English sometimes, spoken about similarities. We've already spoken about differences, in which we said the first difference is the definition itself, because ADHD is characterized by persistent patterns of inattention, non-attention, and hyperactivity and impulsivity. Symptoms are like difficulty concentrating, forgetfulness, fidgeting, and interrupting others. While bipolar disorder involves mood swings. It's a mood disorder, while ADHD is a neurodevelopmental disorder. Bipolar involves mood swings that include depressive episodes, one extreme of the mood, and manic episodes or hypomanic episodes, another extreme of the mood. So, and during mania, as we know, individuals may exhibit heightened anxiety, irritability, racing thoughts, and impulsive behavior. So, this is the definition. So, that's the difference in the definitions. Then we say that the other things that differ between ADHD and bipolar are duration of symptoms. We said that ADHD is chronic and persistent. It's there all the time, in all the settings, work, home, school. If somebody has ADHD, it's there all the time. While bipolar disorders are episodic, there is a couple of weeks of depressive episode, then it might be all good. Then there are a couple of weeks of manic or hypomanic episode, and then there is all good. So episodic, comes and goes, comes and goes. Age of onset was the third one. ADHD typically starts from, like, let's say, first year of age, and then usually crawls into or continues into adulthood. While bipolar disorder usually starts at around 17 to 18 years of age or early adulthood. Then we spoke about the last difference, which was emotional regulation. Though individuals with ADHD struggle with emotional dysregulation, but do not typically experience the extreme mood fluctuations seen in bipolar disorder, while individuals with bipolar disorder experience distinct and severe mood swings, with manic episodes characterized by euphoria or irritability, contrasting sharply with depressive episodes, which is characterized by sadness, very low mood, trying to just stay in the bed, not doing anything, low on energy, and all. Then the last one was actually the treatment. So ADHD is often treated with psychostimulant medications along with psychotherapy, while bipolar is primarily treated with medications which are mood stabilizers and antipsychotics, and can be also accompanied with psychotherapy. Now let's talk about the similarities. Number one is impulsivity. Both conditions can manifest impulsive behavior. So impulsivity is actually in the definition of ADHD, while individuals with bipolar may also show impulsivity. Individuals with ADHD may act without thinking, with those with bipolar may show impulsivity during manic episodes. So during depressive episodes, they don't show impulsivity as such, but during manic episodes, they can show a lot of impulsivity. Then number 2, emotional dysregulation. As I had said earlier, though emotional dysregulation is one of the differences as well, but it can also be one of the similarities. So individuals with ADHD often experience difficulties in regulating their emotions, leading to frustration and mood swings. Similarly, emotional instability is a hallmark of bipolar disorder. Like impulsivity is the hallmark of ADHD, but bipolar can also exhibit that. Similarly, emotional dysregulation is actually hallmark of bipolar, but ADHD people can also exhibit that. So you know how it is. Impulsivity was the main characteristic of ADHD, but bipolar can also exhibit it in manic episodes or hypomanic episodes, while emotional dysregulation is a hallmark feature of bipolar disorder, but people with ADHD can also have difficulties in maintaining or in controlling their emotions. Then comes impact on functioning. Both ADHD and bipolar disorder can significantly affect daily functioning, including academic performance, occupational functioning, and interpersonal relationships. The symptoms can lead to challenges in maintaining consistent work and social interactions. The other day, I was listening to a podcast by a professor, a very renowned professor. I've just forgotten the name. I'm very bad at names, and my memory is also very goldfish. So, professor was saying that people with bipolar are actually highly intellectual people of the community. They usually have very, very high IQ. They are very, very, very productive people of our society. They are really, really, really intelligent. But then when this intelligence is overcome by bipolar, and because it's episodic, those episodes can actually hinder their performance a lot. So treating bipolar is actually very, very satisfactory, because what we do is we return these highly functional and highly working individuals back to the society, back to their work, back to them being beneficial. So that is very, very important. So impact on functioning, both ADHD and bipolar have got their home and professional lives, like their personal and professional lives, are both affected adversely. Then we have got comorbidity. There is a notable overlap between the two disorders, with individuals diagnosed with ADHD being at an increased risk of developing mood disorders, including bipolar disorder. This comorbidity can complicate the diagnosis and treatment process. So maybe people with ADHD who are just being diagnosed with ADHD currently do not have bipolar disorder, but they are at an increased risk of developing bipolar disorder at some stage. Treatment overlap. Some treatment strategies such as psychotherapy can be effective for both ADHD and bipolar disorder. Behavioral therapies may help manage symptoms and improve coping strategies in individuals with either condition. So, though the medication choices are different for both of them, ADHD is cured by psychostimulants, while bipolar is cured by mood stabilizers and antipsychotics, but behavioral therapy and psychotherapy can help both of them. Catch you later.